Good morning, everyone. I'd like to welcome Secretary Bogen, Commissioner Humphreys, and all our guests who joined us today. Thank you. My name is Paul Bowers. I am the pharmacist and pharmacy manager here at Seawright Pharmacy. We are an independently owned pharmacy that has been serving this community of Uptown Harrisburg for 70 years. As an independent pharmacy, we pride ourselves in our personalized service, and we have a unique ability to provide a wide range of pharmacy services. We provide things such as custom prescription compounding, adherence packaging, on top of traditional medication dispensing, and routine and seasonal vaccine administrations. In the last few weeks, I've had numerous communications and interactions with patients and colleagues, many of whom raised questions and concerns about vaccines and vaccine eligibility. Today, with the help of Secretary Bogen and Commissioner Humphreys, I hope we can answer these questions to help inform and guide all patients about who is eligible for vaccination and the benefits of getting vaccinated. The fact is, now is the ideal time to get vaccinated to ensure the most protection for this upcoming season. Whether it's us here at Seawright Pharmacy or whoever you use for your prescriptions, contact your local pharmacy today, schedule your vaccine appointments, and thank you again for coming. What I'd like to do now is introduce the Pennsylvania Secretary of Health, Dr. Debra Bogen.
Good morning. Thank you, Paul, and thank you to Seawright Pharmacy for hosting today's event. As Paul said, I am Dr. Debra Bogen. I'm Pennsylvania's Secretary of Health, and I'm joined here by Pennsylvania Insurance Commissioner Mike Humphreys. It's also great to have our representatives, Nate Davidson and Justin Fleming, here to support our vaccination efforts. It is fitting to be back here at Seawright Pharmacy to talk again about the availability of the updated COVID-19 vaccine. Similar to last year, today I want to encourage everyone who is 6 months or older to talk to a healthcare provider or pharmacist and get the updated COVID-19 vaccine before we get further into the respiratory virus season and before most of us get together with our friends and family for the holidays. This year, I want to start by clearing up any confusion about the availability of the updated COVID-19 vaccine here in Pennsylvania. The COVID-19 vaccine is readily available and recommended for all adults, pregnant women, children between the ages of 6 and 23 months, and most children between 2 and 18. A prescription is no longer needed. You can now get the COVID vaccine without a prescription. Please consult a healthcare provider, including pharmacists, if you have any questions before getting the vaccines to protect yourself and your family. There is no cost to insured Pennsylvanians for the COVID-19 vaccine through at least December of 2026. And I'll let Commissioner Humphreys tell you more about that in just a few minutes. The ideal time to get your updated COVID-19 vaccine is right now, before the end of October. Getting vaccinated now gives your body time to build up immunity against the virus before cases start to increase. If you can't get your vaccine in October, I recommend getting vaccinated before gathering with family and friends over the holidays or as soon as you can. The Shapiro administration is committed to ensuring Pennsylvanians and their doctors and healthcare providers have clear, evidence-based information to make informed healthcare decisions. That's why the Pennsylvania Department of Health recently issued new vaccine guidance based on advice from trusted national medical societies, including the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Obstetricians and Gynecologists. That's also why Governor Josh Shapiro signed an executive order to safeguard Pennsylvanians' access to vaccines by directing state agencies to take several immediate and longer-term actions, such as creating a state-based safety net to protect children's access to vaccines, aligning state vaccine policies with trusted medical experts, as I previously mentioned, and creating an online vaccine portal at pa.gov/vaccines. The executive order also establishes a vaccine education work group to improve communication and fight misinformation protect Pennsylvanians of all ages, and strengthen Pennsylvania's public health leadership. Because of the actions taken by the Superior Administration, Pennsylvanians have access to the updated COVID-19 vaccine that is readily available, again, without a prescription. Unfortunately, COVID-19 is still causing Pennsylvanians to get extremely ill and end up in the hospital. According to CDC data, during the just 1 week in September, nearly 500 Pennsylvanian adults and 55 children were admitted to hospitals due to COVID-19. And during the last respiratory season, the Centers for Disease Control and Prevention recorded 1,280 COVID-related deaths among Pennsylvania residents. Prevention is the best option. Vaccines provide the best protection against severe disease by boosting the body's natural immune system against germs that make us sick. If you are not sure where to get your vaccine, you can visit the website vaccinefinder.org to find vaccine availability near you. Meanwhile, hand washing, good air circulation can also help reduce the transmission of viruses that cause COVID-19, influenza, and other respiratory diseases. Now it is my pleasure to introduce Insurance Commissioner Mike Humphreys to discuss vaccine coverage by insurers. Thanks, Mike.
Thank you, Dr. Bogen, C. Wright Pharmacy, and the representatives joining us here today, not only for organizing the event, Dr. Bogen, but for being here to support the message. It's good to be back, and I'm ready to get poked again. I am Mike Humphreys, and I have the honor of serving as Pennsylvania's Insurance Commissioner. This morning, our message is simple. Cost shouldn't be an obstacle to any Pennsylvanian that wants the COVID-19 vaccine. Pennsylvanians should not forego COVID vaccine because they feel like they may get an unexpected charge. For insured Pennsylvanians, your health insurer must cover the full cost of recommended vaccines. If you have comprehensive major medical health insurance, Medicare, CHIP, or coverage through the PEBTF for state employees, you can receive the COVID vaccine free of charge at an in-network provider. Your insurance company or healthcare provider should be able to help you find a vaccination location that is in-network, or you can call your provider ahead of time to make sure you will not be charged for either the vaccine or the office visit. PID understands that there's a lot of uncertainty surrounding health insurance right now. One thing that we don't want consumers to be confused about, though, is immunization coverage. 3 weeks ago, Governor Shapiro signed the executive order to safeguard vaccine access for Pennsylvanians and protect families' freedom to make their own health care decisions. Last week, PID answered the governor's call with a notice that reaffirmed our expectation that insurers cover the COVID vaccine and other important vaccines during the 2025 and 2026 calendar year. So that's through December 31st of 2026. PID expects Pennsylvania's insurers to cover the cost of the vaccine at no cost for the insured, consistent with the coverage that was approved for sale in 2025 and consistent with the promise of coverage made to the insured at the time that they purchased coverage for 25, and that extends through the end of 2026. Consumers who have had any issue receiving the COVID vaccine at an in-network provider should feel free to contact our department for assistance or to answer any questions about cost and coverage. Lastly, if you're currently uninsured, now is the time to think about obtaining coverage for the remainder of this year or for 2026. For anyone looking for coverage for 2026, the open enrollment period for individual market coverage will begin on November 1st. You must apply by December 31st for coverage that begins on January 1st. To learn more about Penny, where you can achieve financial assistance through premium tax credits, please visit PENNIE.com, as that is the only place to go for individual market coverage that will apply those tax credits and make coverage more affordable. Penny offers free help by phone and in person across the Commonwealth. Again, we want you to know that the Pennsylvania Insurance Department is here to help. We encourage all consumers that have questions about their insurance or an issue with coverage to contact us at pa.gov/consumer or pa.gov/insurance. With that, I'd like to turn it over to Representative Davidson to make a few remarks.
Thank you, Commissioner. I didn't have any prepared remarks today, so it's off the cuff. My name is State Representative Nate Davidson, and I want to welcome everyone to Uptown Harrisburg. It's a beautiful fall day here in the city of Harrisburg, and right in our neighborhood, Dr. Bogen, my neighbor. You know, one of the great things about Uptown Harrisburg, I'll start with a little historical context, is right on the riverfront we have a peace garden. And the Peace Garden has a number of plaques with quotes from peacemakers throughout our history. And one is from President Eisenhower, who said nearly 70 years ago that we seek victory. We seek victory not over any nation or peoples, but we seek victory over ignorance, poverty, disease, and human degradation wherever they may be found. And I think back to the legacy of public health in America. And I think back to the greatest generation who defeated fascism in Europe. And the institutions that they build up here in America that bring us to this point where we have the ability to prevent disease. So I am here to welcome you to Uptown Harrisburg and congratulate and thank the Shapiro administration. They are taking the lead to preserve the public health, and they deserve to be commended for that. And I also want to say one more thing, actually, Dr. Bogen. Just yesterday, it was just yesterday I received my first flu shot and my COVID shot. So I am all set for the holiday season and the respiratory illness season, and I encourage all of my neighbors here in the city of Harrisburg, my friends in Cumberland County as well, and all across the Commonwealth, please contact your independent local pharmacist, contact your primary care physician, and get your flu and COVID shots this fall. And don't forget your children. I have a 1- and 2-year-old, and we'll be seeing our physician later next month. So thank you again, and now I'd like to turn it over to my neighbor, Representative Justin Fleming.
Good morning, everybody. I'm Representative Justin Fleming, and the district I represent starts about 2,000 feet that way, so as you travel further north. So this is right in my backyard, quite literally, though not my district. But thank you so much, Paul, for being so hospitable and opening up the C. Wright Pharmacy to us today. And I just want to thank the Shapiro administration, as everybody said, to ensure that these vaccines are still available in this time of misinformation, in this time where, vaccines stop polio, to expand on Representative Davidson's point about historical context. Vaccines matter, and vaccines are wonderful for the public good. We have eradicated so many diseases through vaccines. Now, the COVID vaccine doesn't eradicate it, but what it does is it mitigates the symptoms that you may and the effect it may have on your body. And so, like Representative Davidson, I went a few weeks ago to my local pharmacy with my wife and my daughter to receive my flu shot and my COVID shot. And Commissioner, got a little sticker shock because it turned out my wife registered for us. And when I sat down, I heard the cost of the vaccine, and I said, no. I am an insured Pennsylvanian, and so I was able to go to the pharmacy and register myself. But I will say that was a little shocking to me because I think the cost was around $275 or something like that. So, what we need to do as well is make sure that we can get as many people insured. So if we want folks to be as healthy as possible and to avoid illness during the respiratory season, we need to make sure that more people can afford Penny or CHIP or any other public or private insurance that's available. And so I want to add that to our charge today as well, in addition to not only informing the public about vaccines, but make sure that you can access insurance, and we as a government has a responsibility to make insurance more affordable. And so that's my message today, but I thank you again for being here. This is an extraordinarily important issue and an important topic, and I'm happy to join with Dr. Bogen, Commissioner Humphreys, Paul, and my great colleague, Representative Davidson, to talk about this. And again, we're vaxxed, we're boosted, and we hope you will do the same. So thank you so much, everybody. And I'd like to now turn it over back to Dr. Bogen if you have any questions.
All right. Thank you guys so much for being here. Thank you all for participating today. We're happy to answer any questions if there are any. Yes.
I'll start. First off, thank you for being here today. There's a lot of confusion over what the federal government is saying versus what the state is saying. Who should people listen to?
Again, the current information is that all people are eligible for vaccines. And the differences are subtle, but all people are eligible for the COVID-19 vaccine, 6 months and older. And that information is consistent with the recommendations from the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the American Academy of Family Physicians. That is the guidance that we are all following to make sure that we are getting evidence-based support, science-driven decision-making. So again, everyone is eligible. It is available without a prescription. Anything else? Yes.
Good morning.
Good morning.
What are your concern levels regarding vaccination of preventable disease in other states based on what the federal government has to do?
At other states? I'm sorry. We are, I'm a healthcare provider, I'm a pediatrician. I think the message across the country is consistent across the medical fields, right? We are all saying the same thing. We are saying that follow the guidance of your medical societies, that your medical specialties, listen, consistent messaging. And I think that really is our work today, and that's why we're here today, really to make sure that you're all giving that important message. Vaccines have decades and decades of science behind them. They are safe and they are effective, and they really do prevent, depending on which vaccine you're talking about, they all work basically by boosting the immune system. Some completely prevent infection, where others reduce the severity of infection and reduce the hospitalization risk and death. But these are all really safe. There are, again, decades and decades and decades of science behind these important vaccines. And I think the message across the country is that our medical societies are providing us evidence-based information, and that's who we should be listening to, our medical experts. Anything else? All right. Well, hearing none, Paul and his team now will administer our updated COVID-19 vaccines. I'm excited to be getting protected. I have a family member who's immunocompromised, and I really, again, want to emphasize how important this vaccine is to protect our friends and neighbors as well as ourselves. And so I look forward to having this vaccine. I got my flu shot a couple weeks ago, and again, I'm thrilled that our House of Representatives, representatives from the state are well covered in their vaccines as well. So thanks so much for being here. All right, Paul.
All right.
We're ready.
Thanks so much.
Thank you all.
Really nice meeting you. questions and concerns about vaccines and vaccine eligibility. Today, with the help of Secretary Bogen and Commissioner Humphreys, I hope we can answer these questions to help inform and guide all patients.
Vaccine here in Pennsylvania. The vaccine, the COVID-19 vaccine, is readily available and recommended for all adults, pregnant women, children between the ages of 20. I recommend getting vaccinated before gathering with family and friends over the holidays or as soon as you can. The Shapiro administration is committed to ensuring Pennsylvanians and their doctors and healthcare providers have clear, evidence-based information to make informed.
You said left arm, right?
My left arm. I always smile during my vaccine. No wincing, right? I'm used to holding small children for vaccines.
I think he pre-say. I thought that too. I was like, wait a minute. They're getting really good at this now.
I didn't feel it. He's good. He's good. Remember that from last year. Very deft. Thank you.
Right, exactly.
Yeah, I got one in the left, one in the right.
All right, thank you. Okay, it's COVID, right?
COVID.
That's right. Find something.
Quick and easy. Yeah, right. Really small. Thank you.